recognize United Way of Connecticut as the Crisis Center Excellence Award winner. And I invite Lisa Tepper Bates, Tanya Barnett, and Wendy Caruso to join me on stage.
Thank you so much. And if you'll indulge us, we'd like to just tell you a little bit more about 211 Connecticut and our crisis services. So I'm Lisa Tepper Bates, and I have the privilege to serve as president and CEO of United Way of Connecticut. And in all fairness, I've only been in this job for 18 months. So the work that I'd like to tell you about is not so much about what I've been able to do, but about what this great team, who I have the joy to stand up here with, what they've done, these two women especially, and my colleague Chris, who is our photographer for United Way of Connecticut for the evening. So just so that we can set the stage for you, 211 of Connecticut, as some of you probably know, 211 is a free and confidential information and referral service that connects people in need to the services that they need, one person at a time, all day, 24 hours a day, all year round. So in Connecticut, 211 is connection to basic needs for struggling families. 211 Connecticut is emergency and disaster response when there are hurricanes or heat waves or blizzards. 211 Connecticut is housing crisis help. We are the centralized intake for homelessness for our coordinated response system across the state of Connecticut. And perhaps most importantly, 211 Connecticut is crisis intervention, providing support, empathy, and connection for people facing a crisis. Since our founding in 1976, we've grown from a small volunteer-led string of call centers scattered across the state, working part-time with paper lists of community resources, to a single, robust, 24/7, technology-driven professional team covering the geography of our entire state, responsible for Connecticut's most comprehensive directory of state, federal, and community resources. Our directory is 4,000 organizations providing 40,000 programs just in Connecticut. Looking back and talking with colleagues who were with 211 Connecticut from the beginning, back in 1976, it was clear almost from the start that 211 could, and indeed was really called to play a role in supporting those facing a crisis. Generations of leadership at United Way of Connecticut and 211 really saw that we could serve our public best if we could serve them across a full range of needs. And that means from emergency food to homeless shelter, from child care to mental health. Because we saw that many, if not most, crisis situations are not about one challenge. They are about a convergence of many challenges at one time. And so 211 Connecticut set about to build our capacity to play a role not only as an information and referral service, but as a crisis center with, thankfully, very close partnership of our state agencies. So coming forward for more than 30 years, 211 Connecticut has handled the Connecticut Calls for Lifeline. Since 2009, 211 Connecticut has served our state child welfare agency as the phone-based entry point for mobile youth crisis support. And since 2015, we've partnered with the Connecticut Department of Mental Health and Addiction Services to enhance our suicide prevention support, including in the past 24 months, to link 211 crisis services to our state mobile mental health crisis teams for adults. And as Chris mentioned, though there are in many states, including Connecticut, multiple numbers that people can use to find help, we're very proud of the fact that the majority of those different phone numbers do filter to our crisis team. And that will include 988 when that rolls out in July. And while we're always looking to improve, enhance our services, reach even one more person effectively, I do want to say that we're proud of the results that we have to date. And so just to give you a sense of that, in 2021, our crisis team handled 124,000 adult crisis calls. And of those, 94% of our callers reported to us that their state of crisis diminished during their call. And really proud to tell you that in less than 1% of the adult calls did we have to escalate the call to 911. With regard to youth, we had about 14,000 youth crisis calls last year, and in 93% of those we were able to dispatch the mobile mental health crisis teams to provide help. And in only 3% of the youth crisis calls did we actually have to escalate to 911. And so to me, that's what it looks like to do this work in the best way possible. We would not be here though tonight, as I said up front, without the hard work and the commitment and the innovation and the perseverance of two really incredible and dynamic leaders who are here with me. Tanya Barrett, our Senior Vice President of Health and Human Services for 211, and Wendy Caruso, our Senior Director of the 211 Contact Center Operations. I want to thank them for their vision, their team spirit, and truly their path building as we are learning together as a nation how to think about effective crisis response. I also want to thank Chris Dumas, who serves as our first ever full-time director of the crisis team and has played a key role in growing our team at light speed as we ramp up to meet the increased need in these challenging times and to get ready for 988 rollout in July. And of course, our greatest asset are our contact specialists. Really important to say that. They work tirelessly, 24 hours a day, 7 days a week, holidays included, going crisis call to crisis call. And they truly are saving lives, making a difference one call at a time. So it's an honor for that team. It's an honor for the three of us up here. It's really an honor for United Way as a whole. And we couldn't do it without the close collaboration we have with our state government. So I just want to also shout out to them and to our colleagues in police, whose cooperation is so critically important. So thank you very much to all of you who are here tonight and to the American Association of Suicidology for this important honor. It's humbling, and we're grateful, and we're inspired by this to keep putting everything we can into this important mission. So thank you very, very much on behalf of United Way.